Hello and welcome to this edition of Health Talk on Channel NRT. Today, we will be looking at high blood pressure, also known as hypertension. We will briefly look at the definition, statistics, complications, signs and symptoms, risk factors, treatment, and prevention. But our main focus will be on prevention. Hypertension is defined as blood pressure readings of greater than 140 millimeters of mercury in systolic pressure, and readings of greater than 90 millimeters of mercury in diastolic pressure. Globally, the prevalence of hypertension is estimated to be 40%. The distribution of the disease burden per continent is as follows: 46% in Africa, 35% in America, 35% in Asia, 44% in Europe. Hypertension is one of the major causes of morbidity and mortality across the globe. However, despite being one of the leading causes of hospital admission and deaths, the majority of people with hypertension do not realize that they do have the disease. This is because they have not been formally diagnosed of the disease and are therefore not on any form of treatment. Uncontrolled high blood pressure causes permanent damage to vital organs of the body such as the brain, the heart, and the kidneys in long term. This is the reason why hypertension is known as a silent killer. The long-term effects of undiagnosed hypertension include, among others, cardiovascular diseases, kidney damage, and stroke. As a silent killer, hypertension may not present with symptoms at all. However, other notable symptoms include severe headache, fatigue, confusion, dizziness, blurred vision, chest tightness, difficulties in breathing, irregular heartbeat, blood in urine, and pounding in your chest, head, or ears. The risk factors of hypertension are as follows: overweight, excess dietary intake of salt, lack of physical activity, excessive intake of alcohol, stress, old age, ethnicity, and gender. Treatment. The following classes of drugs are used in the treatment of hypertension: diuretics, beta blockers, ACE inhibitors, angiotensin II receptor blockers, calcium channel blockers, alpha blockers, alpha-2 receptor agonists, combined alpha and beta blockers, central agonists, peripheral adrenergic inhibitors, and vasodilators. Prevention. Since knowledge is power, we suggest that the first and most important step in the prevention of hypertension is getting to know whether you have the disease or not. It is therefore important to see your doctor and have your blood pressure checked. This will not only give you baseline data but also help you decide whether to be on treatment or simply adopt risk reduction measures. The baseline data is also useful for purposes of future evaluation of the specific interventions you may adopt in an effort to control or prevent hypertension. Make a decision now to visit your doctor after watching this video. Diet. Eating a diet that is rich in whole grain, fruits, vegetables, and low-fat products can lower your blood pressure for up to 11 millimeters of mercury if you have high blood pressure. Again, eating a lot of fruits such as bananas and vegetables can help boost your potassium levels. Potassium is important since it reduces the effects of sodium on blood pressure. But please do not take potassium in form of tablets or food supplements unless prescribed by our doctor. Other important tips to help you adopt a healthy diet include keeping a food diary to monitor your true eating habits. And also, be a smart shopper by reading all food labels. This will help you to monitor the amount of calories you take every day and make adjustments accordingly to make sure you stick to your health eating plan. Cut back on the intake of salt. Aim to limit sodium to less than 2,300 milligrams a day or less. However, a lower sodium intake of 1,500 milligrams a day or less is the most ideal for adults. You should also pay attention to the amount of salt that is in the processed foods you eat, such as canned soups or frozen dinners. Cut down on caffeine. Caffeine can cause a short, but dramatic increase in your blood pressure, even if you don't have high blood pressure. Cutting down the intake of caffeine is therefore a sensible thing to do in an effort to reduce the risk of hypertension. Get a good night's sleep. Getting a good night's sleep helps you to relax and reduce stress levels. Therefore, a good night's sleep is important in maintaining normal blood pressure. Quit smoking. Smoking causes an acute elevation in blood pressure. It also narrows down your arteries, increasing the risk of heart attack and stroke. Therefore, stop smoking to reduce the risk of hypertension and its complications. Limit your intake of alcohol. Regularly drinking excess alcohol can raise your blood pressure in long term. It also adds extra calories which may lead to weight gain. Staying within the recommended levels is the best way to reduce your risk of developing high blood pressure. Men and women are advised not to regularly drink more than 14 units a week, a maximum of 2 bottles a day. We suggest that you spread your drinking over 3 days or more if you drink as much as 14 units a week. Stay active and do regular exercises. Regular physical activity can help lower your blood pressure, manage stress, reduce your risk of several health problems and keep your weight under control. Physical activity can help you maintain a healthy weight and lower your blood pressure. For adults, 2 hours and 30 minutes of moderate intensity exercise, like brisk walking or bicycling, every week. Children and adolescents should get 1 hour of physical activity every day. Maintain a healthy weight. Keeping a healthy weight, or losing weight if you're overweight or obese, can help you control your high blood pressure and lower your risk of related health problems. In general, you may reduce your blood pressure by about 1 mmHg with each kilogram, about 2.2 pounds, of weight you lose. For more information please visit www.channelnrt.com and thanks for watching.